The Brain Tumor Center is a complex effort by Siteman and in partnership with Barnes-Jewish Hospital in WashU. It's really centered around any patient with a brain tumor, whether that be, a benign brain tumor or a cancerous brain tumor. We really want to tackle the patient from multiple angles. So, number one is their diagnosis and finding out what their individual tumor is and what its makeup is. Two is the actual treatment, and that can be a combination of surgery, radiation therapies, chemotherapies, and then also the research infrastructure that supports possibly coming up with novel treatments for an individual patients, and then a multitude of patients in the future by studying individual tumors, their individual genetic makeups, and individual characteristics. One thing we do at the Brain Tumor Center is we try to, catalog and log as many tumors as possible to be used in our various aspects of research. Our research institution is growing by the day with new scientists, new clinicians who work together to study almost every tumor that we're able to remove surgically, and having that tissue is invaluable to understanding tumors and understanding their treatment. Well, what I'm most excited about is things becoming less and less invasive and less, taxing on the patient for treatments as we move forward as a discipline. And I train to do, large, complex, radical surgeries, but my practice has evolved over time to where we're doing smaller and smaller, less invasive surgeries that still have the same result on the patient, but don't put them through so much in terms of a procedure, so that they're recovering faster, they're back at home faster, they're back to a normal life much sooner than we were 10 years ago even. The team is the best part of Siteman in any sort of care, and I think my role in the patient, even though it may seem important when you're doing a big and complex surgery at times, is only one very small piece of the puzzle longitudinally over time, and we're able to bring in experts from every aspect of the care. I've known I wanted to go into medicine since I was probably a child. I was heavily influenced by a grandmother who was an ICU nurse and a mother who was a physical therapist who specialized in the care of handicapped children. She specifically took care of children with brain disease that had, cerebral palsy and spina bifida, and she made my brother and I volunteer at her nonprofit clinic at an early age. So since I can remember as a child, even being 7 or 8 years old, volunteering with that patient population, and then some of them were actually close friends of mine, and I saw how through different providers, they could have a big impact in their lives and their disease processes. Since a lot of them have neurological problems, it kind of inspired me to eventually become a neurosurgeon. I think that's one of the most rewarding parts of the job is to know that you had a hand in improving their lives and their quality of life long term, and that you gave them hope, and to see that hope manifest itself several years down the line, I think, again, is just the most rewarding thing.